Hypocalcemia and hypovitaminosis D is a problem globally. In even in Bangladesh, the acidity study says it has very high prevalence, both low vitamin and low calcium. People are not recognizing the symptoms because we do not check the labels. So around 60 to 90%, different in some places almost 100%. So what are the presentations of this hypocalcemia? Usually it is asymptomatic and nutritional situation when it is worse, when there is renal impairment, when there is other hepatic disease, even without disease, nutritional vitamin D deficiency, and along with it, calcium deficiency is quite common, and there are some genetic vitamin D dependent rickets, BDDR, and prematurity, birth asphyxia, low birth weight, maternal deficiency, food deficient of vitamin D and calcium. They are quite common and widespread. Hypomagnesemia and blood transfusion, seclusion of the magnesium and calcium. So there is widespread hypocalcemia. It remains undiagnosed. How do present clinically? Paresthesia of the face, hands, and feet, and neonate, they can have convulsion. Frank, there can be apnea, and there can be sudden cardiac arrest and even death. So and your congestive cardiac failure. So to understand this grave the situation, you can check your signs of latent tetany, like your Vostok signs, stepping the facial nerve, the orbicularis oris contraction. You are raising the BP between the systolic and diastolic. You see the your carpopedal spasm. You call it what do you call it? You call it Trousers sign. You can also see the peroneal sign. Basically, hypocalcemia nerve irritation features. So in chronic hypocalcemia, there can be excessive amount of mucocutaneous candidiasis, which is quite common in this country. Commonest cause of mucocutaneous candidiasis may be the bad oral hygiene. Along with it, hypocalcemia is a contributory factor. So there can be cataract, there can be brain involvement with extrapyramidal symptom, EPS. So enamel hyperplasia, gum, your teeth, so teeth decay, and dry skin and loss of hair. Plenty of organs with diverse sort of presentations is possible with hypocalcemia. So it's to be addressed. Food rich in calcium, the milk, the fish oils, that should be consumed. Sunlight exposure, there is 90% source of vitamin D, and even then someone can have vitamin deficiency. So periodic exposure, periodic intake of calcium and vitamin D, 500 milligram calcium daily for a few months, and so usually course is deficient subject 3 months, and followed by maintenance dose of vitamin D 400 IU in the younger kids, and above it is 600 IU adult or adolescent child. And in symptomatic cases, when there is a frank convulsion or something, you give it IV. Rest of the cases orally, and make sure that sufficient food rich in vitamin D are being ensured. Sunlight exposure is also important.